I'm Venkat Ramakrishnan. I'm a plastic surgeon. I practice breast reconstructive surgery as a plastic surgeon. I've been doing this for the last 30 years. I've spent most of my time in UK and I've returned to India now. I continue to work with some of the centers in UK, but in a very part-time basis. But most of the time I work here in India. I'm part of the Apollo Athena team in Delhi. I hope to spend my next decade of my life here promoting breast reconstruction awareness and teaching breast reconstruction surgery. October 15th is the World Breast Reconstruction Day. That's why we are having the meet today and we are talking about it. Society, which includes the family members and the primary physician who treats the cancer, have to view the mastectomy as a potential deformity. And if the patient has concerns about the psychological aspects of accepting it, we need to be empathetic and provide them with information of how best they can seek reconstruction. In the past 3 decades of my life, professional life, where I've been doing breast reconstruction in the West, I've seen it growing exponentially. Maybe 20 years ago, hardly 5% or less people in the Western Europe and America would have reconstruction. Today, over 70% have reconstruction. But in India, for some reason, breast reconstruction has not caught on. We have looked at all various reasons. We're thinking it's cultural, or possibly financial, possibly societal, possibly the primary doctor doesn't offer it to the patient, or a combination of all of them. But the truth is, we do reconstruction in less than 0.5% of patients who have mastectomy, while in the West, it is almost 3/4 of the patients who have mastectomy have reconstructions. It's been well recorded that the women who seek breast reconstruction, I emphasize seek because there are some women who do not want it and they are very comfortable without having the reconstruction. But most women who seek reconstruction are benefited psychosocially and their mental health is much better compared to patients who did not have reconstruction. So it is not for all, but certainly those who wish to have it do better when they have it. The psychological recovery after a breast reconstruction, it's very difficult to quantify it. As I mentioned, if the lady is very keen not to have a deformity from a breast removal, she's going to be happy if there is a breast that's reconstructed. More aesthetically sound, better her feeling would be. It is very important to recognize reconstruction as a correction of deformity. We should not confuse this with vanity surgery. It's not like making the breast bigger. The breasts are normal, they want it bigger or smaller or uplifted. It's very different to it. To have one breast on one side and a scarred chest on the other side is a deformity. If somebody has a scar on the face, we would all be very supportive of them having a corrective surgery to correct the scar. But we don't seem to have the same amount of veracity in supporting somebody to have a breast reconstruction. It possibly is because we don't see the deformity. It is the society which doesn't see the deformity, which does not give it as much importance as another deformity they can visualize. But the operation of reconstruction is not for the society, it's for the woman who feels and sees the deformity on a daily basis. Breast reconstruction can be done either with implants. This is silicone implants which are man-made and they can be put under the skin to give a projection like a breast, or we can have reconstruction using patient's own fat, which is the best form of reconstruction, usually from the tummy, sometimes from the thighs or even the buttocks. We can take the fat, excess skin, and mold a breast and fit it. But in these cases, we need to connect the blood vessels. It's not just shifting the fat. The fat has to be shifted with the blood vessel, and the blood vessels have to be connected locally so the tissue can live straight away. The role of the family in deciding breast reconstruction, especially in India, is huge. In fact, the lady or the girl, depending on the age when the breast cancer is detected, is under a lot of duress. There is a stigma that surrounds the breast. And as I mentioned earlier, people don't see the deformity, so they don't think there is a deformity because the lady wears a piece of plastic or a stuffed sock inside the bra to give the appearance of a breast. But she feels it every day. She sees it every day. And every time she moves, the prosthesis rubs against the chest. If it's a sweaty afternoon, it slips down. So these are all potential problems she feels, and she's conscious of it all the time. So I think it is not an option we can avoid the lady from seeking. If it is available, it should be offered, and the family member should support it.